Thank you for coming in the class. I'm so glad to be here. And then, how are you?
I'm fine. We are fine.
We are fine. So, I will, before we start our presentation, let me introduce myself. Myself is Japar, and then I'm going to talk about stroke attack. And then, so my presentation will take about 5 or 7 minutes. So there's some highlight to explain all the stroke attack. So first, I will start with definition. What is a stroke? So a stroke is a disturbance in the blood vessel leading to or within the brain, because this blood vessel feed the brain oxygen and nutrition. So, and then I hope if you please feel free to ask me anytime. So this is the definition of the stroke. There are 2 types of stroke. As we say in the whiteboard, type of stroke is first is semi-stroke, and number 2 is second, or number 2 is hemorrhagic stroke. What is the kind of difference between 2 of this stroke? So ischemic stroke is blockage of blood vessel, loss of blood flow to affected areas. So there are the blood vessel, there's something a blood flow to your brain. And then number 2 is hemorrhagic stroke, rupture of blood vessel, leakage of blood in affected area. So your blood ruptured to your brain area. So what are the symptoms of the stroke attack? So there are many signs or symptoms the stroke effect. So the most popular in our knowledge about stroke is first numbness or weakness in the face, your arm, your body, your leg, especially one side. And then number 2 is confusion. Suddenly you confused to do anything. So in the trouble speaking or understanding. Number 3, trouble seeing in one or both. So suddenly you can see clearly. Number 4, trouble walking, dizziness and loss of balance or coordination. So you cannot control your body, you cannot control your walk. And the last, serve headache with no source. So these are the symptoms of the stroke. So what we do when the stroke attack our family or especially our body. There are treatment if you act of stroke. So there's face. The face you look uneven. It's not usually you look. Number 2, arm. One arm hanging down. So suddenly you cannot control your arm. Number 3, speech. You can suddenly slur speech. You cannot speak clearly. And the last, if you get a stroke attack, you should fast to call ambulance. So this is the impact of stroke. As we know that stroke is, there are 2 kinds of stroke, and that our body is divided into 2 sides. Alright, left brain side and then right brain side. So if the stroke impact in your right brain side, so your body will be uncontrolled in the left side. You can see and the blue color when your brain side get a stroke, so your left body will be uncontrolled, like a paralyzed left side spatial, behavioral, and memory defective, because the left brain it's memory, something mathematics and other. And when you get struck in the left brain, you can write over your body right side will be uncontrolled, like a paralyzed right side, speech language, and some things like that. So if anyone want to ask me, so don't be hesitant to ask. So this is cause of strokes. First and the most popular causes of stroke is smoke or cigarettes, and then drug abuse, overweight, junk food, and then sometimes there's you lazy to exercise. And then stroke in the word. So we expose the map of words that the stroke can be affect all in the world. And then Indonesia, red color is that's a high data of stroke in the world. So when we see the Indonesia area stroke, there's the killer silence or disease number 3 in the world. So it's a high in the world, number 3. Okay, that's all my presentation. So I hope I get some feedback or some question for all my presentation. I think my speech or my voice it's so clearly loud and something. Just thank you for my presentation.
Yeah.